failure specialist who's at the Kokilaben Dhirubhai Ambani Hospital in Navi Mumbai. Uh, we have invited him to speak about heart care for seniors. It's a very general topic, but September 29th is World Heart Day, and we thought it would be appropriate to have a session on that occasion on heart care for seniors. Before I invite him to speak, a little about him. He has been at the forefront of cardiac healthcare in the Mumbai metropolitan region, and he has trained at the prestigious St. GS Medical College and KEM Hospital, and his expertise is in interventional cardiology and heart failure management, which is, as his profile says, he's unparalleled. He studied at the GS Medical College and the Grant Medical College and the European Society of Cardiology. Welcome to Health Live at Seniors Today, Dr. Amit Singh. How are you?
Yeah, I'm fine. First of all, I would like to thank you for inviting me on this platform. And I hope to do my bit to educate everyone
Yeah,
on how to keep your heart healthy.
right,
I think there couldn't have been any better time than this to understand the importance of actually prevention.
right,
So we all know that prevention is better than cure, and we have to focus on prevention because prevention is something which is going to stay with us forever.
right.
Okay.
Thank you very much, Doctor. Before you start the presentation, a small note as we've started doing now. This is being recorded on September 20th, 2025. So if you're watching it 2 years later, do check if there are some latest in terms of medical technology advancements that may have happened, and you may want to update yourself. As always, this session is being recorded, so do not worry about taking notes right now. Just listen in and post your questions to Dr. Amit Singh. It's not always that you get a senior and a very young, doctor who is there in the house on speaking about cardiology. So do take advantage of the fact that he's here and he will be answering all your questions. So over to you, doctor, and then we'll come back later for the questions.
Yeah, so I'll start with, so if you see, the first line of my presentation says, "Jo fit hai, wo hit hai." So this is true for all age groups, be it someone who is in their 20s or 30s, and also someone who is there in their 60s and 70s. Fitness is something which will, help you in the long run. So, jo fit hai, wo hit hai. So, so we usually feel that being healthy is just merely absence of sickness, but it's not true. That is not complete health. Health means you should be physically as well as emotionally, mentally, as well as socially should be healthy. That is what complete health is. So the aims of my presentation is to inform and discuss what healthy lifestyle means, to help you identify the health behaviors which you can incorporate in your daily life. Not that we are going to tell you some very elaborate routines and all. Some small behavioral changes which you can incorporate in your daily routine and which can be maintained in long run. And of course, in that we are going to take your questions and I'm going to answer them one by one. So, so there is something called as the holy four for keeping your heart healthy. Of course, it starts with the nutrition, some physical activity, and then staying away from bad addictions like smoking and drinking. So when we talk about preventing yourself from the heart diseases, so we have to understand that we cannot decrease our risk to zero. We cannot make it come zero by doing anything. So we can only reduce. We cannot make it absolute zero. Why? Because there are some risk factors which cannot be changed. These are called as non-modifiable risk factors. What cannot be changed? Your age cannot be changed. Your ethnicity cannot be changed. The country you are born, the geographical region you have been born in. Usually, Southeast Asians have highest risk of heart disease in entire world. Southeast Asian matlab people who are from India, people who are from Bangladesh, people who are from Pakistan, people who are from Sri Lanka. In fact, Pakistan has the highest risk of heart disease in entire world. In the second comes India. So these are something which we cannot change. Our genetic makeup, our ethnicity, heredity, we cannot change. And of course, age and gender also we cannot change. So that is why we cannot bring the risk zero. But of course, we can change few of the things which can decrease our risk. So what are these risks? We can take care of our cholesterol level. We can take care of our blood pressure. We can take care of our weight. We can take care of our diet. We can stay away from addictions like tobacco and alcohol. Also, we can, take care of our physical inactivity. We can be physically active. So these are the things which we can take care of. So we have to understand why I'm saying this. Many times, patients comes to me and say that, sir, I have been, living a very healthy life. I've been doing everything. Still, how I could get heart attack. So it is important that these are the people, like these are the cases where though the person has taken care of everything, still there are few things which cannot be changed. Just like I told you, the gender, the age, the ethnicity, all these things cannot be changed. So of course, there's some risk always stays, but our purpose, our goal is to bring the risk as low as possible. So we have to understand this thing. So I tell everyone that there are few numbers which all of us should be moving. Abhi, there are so many people over here who must be thinking that I'm completely okay and I don't need to do health checkups regularly. There is absolutely not needed. So it's not true actually. Health checkups, I wouldn't say a very elaborate health checkup, but there are few certain basic numbers which you should know, which you can know by the way of health checkups. That's why I would urge everyone to undergo at least yearly health checkup. So you should know your cholesterol level and triglyceride level. You should know your blood pressure level. You should know your fasting glucose level, whether you are in a in a range of developing a diabetes. You should know your body mass index, whether you're going into an excessive obesity or being on overweight. You should know your waist circumference, and of course, you should exercise at least 30 minutes in a day for at least 5 days a week. That comes to 150 minutes in a week. So 150 minutes of a week is mandatory. So 150 minutes of moderate intensity exercises. When I say moderate intensity, for you all, it can be something as simple as brisk walking. When I say brisk walking, it doesn't mean like walking you are doing a stroll in a garden. वैसा नहीं करना है. It should be fast. You should feel panting. You should feel air hunger. You should sweat. That is actually exercise in real sense. So the walking, just any walking is not sufficient. It should be a brisk walking. So that is what is basic minimum requirements. Basic. So what are these heart healthy behaviors? I'll again say that having a healthy diet, giving up on addictions, maintaining a healthy weight, some physical activity and sleep. That's all. That's all you have to take care of. Rest everything can be taken care of automatically. If you maintain all this, you will definitely have a normal blood pressure, you'll have a normal sugars, you'll have a normal cholesterol, you'll have a normal stress level. Everything will be automatically maintained if you take care of all these behavioral changes. So you have to stop smoking. If someone is already smoking, so you have to cut down on smoking. We all know that if you give up on smoking, you just not protect yourself from heart disease, but also you protect yourself from a lot of other cancers and other lung diseases like emphysema and bronchitis. So there are actually many health benefits of giving up on the smoking. So you have to think. So first you have to understand that why smoking is bad. You have to think. You have to determine yourself of giving it up. Then how can you actually do it? How can you quit the craving? So you can keep yourself busy. I understand in our age group you can keep busy by being with your friend circle, being with your spending time with your family. That is the way of keeping yourself busy. You have to be dedicated to cut down on smoking. You have to keep reminding yourself. Of course, family and friend support means a lot. And family and friend is something which is, which can either make it or break it. If the friends are also smoking, then you might be under peer pressure of continuing it. But if you have right set of friends, then they can definitely help you in giving up on smoking. You have to de-stress yourself. You can at times join few of de-addiction groups. And in the last, if nothing is working out, you can definitely take help from healthcare professionals in the way of nicotine patches, herbals, and few of the medicines which are available to cut down on smoking. And ultimately, in the last, don't give up because nothing is impossible. Now, smoking is done. So now coming to your healthy diet. So see, diet is something which I would say nobody can tailor make it for you. You have to understand what are your requirements and where are the places where you have to make changes. So when I say diet, it's not that you have to go to a dietitian and take a tailored diet. That is impractical. See, dietitians, what they diet they usually tailor make for you, it is difficult to maintain or follow it for a very long term. What simply you can do is you can make changes in your regular diet. That way you can be actually follow that diet for a longer time. So when I talk about a healthy diet, how does the healthy diet should look like? it should be colorful. Your plate should like colorful, and the portion of each color should be nearly same. It should not be like just one color is an excessive. Like suppose you're having a rice and all your plate looks like full of rice only. So it should never be there. Everything have its own role. Even the carbohydrates are required. Even the fats is required. Everything has its own role, and it should be an equal and almost same quantity. So that is how your plate should look like. It should be colorful. It should be full of fruits. It should be some portion of vegetables, some proteins, maybe in the form of vegetarian or non-vegetarian sources of protein, and of course grains. Grains are required. Dairy is optional. Maybe you can add it or not. So what are things you can do actually? So when you're considering dairy, so what I would say, people have this habit of consuming milk. What a simple change you can do is you can switch from full fat milk to a toned milk. So people have this misconception. See, toned milk might not be having any nutrients. So it is extremely wrong. Toned milk has same amount of protein. It has same amount of minerals like calcium. Same. Only the part which is missing is the saturated fat. Okay, so that is what the toned milk is meant for. So if someone is already having some problems like a heart problem, maybe blood pressure or diabetes or cholesterol, what simple dietary change you can make is that you can switch from a full fat cream milk to a fat free or toned milk. That is what is the simple step what you can do. Second thing is choose food with lower sodium. So sodium is something which is culprit for developing blood pressure. It is one of the culprit. So when I talk about salt intake, so in our country, if we compare as compared to the Western and the European population, our salt intake is almost 3 times more as compared to them. So when I say 3 times, our salt consumption is almost 9 gram per day as compared to theirs is between 2.5 to 3.2 gram per day. So we see it's almost 3 times. So why is it happening? Because our food items are full of salt. We require salt everywhere, which is not true in the Western counterpart. When I say Western counterpart, they're indigenous diet, not the fries and burgers and all. I'm talking about the indigenous diet, the Mediterranean diet. So it is less. So why? So because we have habit of putting excessive salt, we have habit of having this concept of table salt, that we put extra salt on our tables when the food is placed on our table. We have to get rid of that. So the simple suggestion which I tell my patients from where we can start is that stop adding salt at tables. That is the first step. Second thing, what you can do is you can substitute your regular salt with a low sodium salt. Low sodium salt, already there are enough options in the market. You can go for anyone. What usually easily available for us is a Tata Light and Tata Super Light salt. You must have heard about it. It is a so these are simple dietary changes which you can do. You don't have to do some extra steps. It's just simple substitution which can actually help making your diet balanced. So salt. Now coming to salt, I have seen a lot of people have this misconception that pink salt or rock salt is better than the regular salt. So I would like to debunk this myth because there are two things which you have to take care of. One thing is if we have kids at our home and we are giving just the pink salt or rock salt, we have to understand that the growing kids have a requirement for iodine. And our government has fortified the regular white salt with iodine. Why? Because the content of iodine in our regular food items is very less. So there is always risk of these growing up kids of suffering from iodine deficiency. So that is why government in 1980s had this come up with this idea of fortifying the salt, which is taken up by everyone, from the poorest to the richest, to fortify it with iodine. So the problem with this pink salt and the rock salt, which are direct of the mined from the nature, they are not fortified. So there is risk of these kids developing iodine deficiency when you're taking them. Second thing is, of course, this pink salt or the direct rock salt have same amount of sodium as compared to the white salt. So if you want to go for a low sodium salt, then definitely pink salt and rock salt is not an option. So of course, if you're having blood pressure, if you're having hypertension, you should think about low sodium salts. And definitely pink and rock salt is a big no from my side. So I think that actually debunks a lot of myths around the type of salt which we should be having. And few people have this habit of having sugary drinks instead of water while having food. So if you're having such bad habits, then you have to definitely give up and you have to stick to the plain simple water. So this is how your plate should actually look like. It should be mix of everything. It should not be just excessive of one thing. So small of everything is better than having one thing excessive, because excessive of anything is bad. So fruits and vegetable, I need not again mention it. I have already discussed about it. They are great source of oxidants, antioxidants, vitamins, minerals. At times they can make a good, healthy, handy and cheap snack. Like a simple banana can be a good snack rather than munching on those chips. And also fruits have a lot of fiber, so they can help you with the constipation if someone is having a constipation. And also fruits have been found to reduce the risk of not just heart disease, but also cancer, stroke, and a lot of other diseases. So of course, fruits have some benefits. So you should consider, think of it. Vegetable comes first. You have to increase your intake of vegetables. Fruits are plus minus. Now coming to carbohydrates have already been put up in a very bad light. So it's not that all carbohydrates are bad. So carbohydrates there are some called as complex carbs. I will not go into detail, but there are some as simple carbohydrates, which are like sugars. So problem with sugar is that as soon as you take them, they cause certain changes in the body. Simple is they cause insulin spike. I'm sure you all must be knowing insulin is a hormone. So when you have a direct sugar, there is a spike, there is a rush of insulin in our body. And insulin, initially it is okay for the body, but in the long run, if there is multiple spike, they start damaging the body. So you have to stay away from the simple carbohydrate. But complex carbohydrate like whole grains, millets, all these things are actually needed for the body, because your body also needs energy to function, right? So you need them. So you should be sticking to the complex carbohydrates and give up on simple carbohydrates like simple sugars, direct fruit juices, direct putting sugar in milk and all. You have to avoid that, putting sugar, having lot of sugary tea and coffees. So I'm sure many people must be loving their tea and coffee. What simple change they can make in their routine is that they can substitute the sugar with no sugar. Or if they cannot have it without sugar, then they can substitute it with the sugar-free sweeteners. So there are multiple sugar-free sweeteners in the market. I'm sure you must have heard a lot of discussions whether sugar-free are safe or not. I'm telling you, they are definitely safe. In last studies, there have been only very few incidences of side effects, but largely they are safe and you can definitely substitute them with the regular sugars. Okay, so you one should not hesitate of going for a low calorie sweetness. So whole grains, I need not tell you in detail. So whole grains, we have to think about millets, we have to think about wheat, we have to think about our regular rice. But rice preferably should be non-polished, because non-polished contain more fibers as compared to the polished one. In proteins, what you can do, proteins, I'm sure you all can, consider having an egg. If someone has a limitation, they are pure vegetarian, then they can switch to soya bean and paneer. They are also a good source of protein. But egg is something which is complete source of protein because they contain all amino acids. So something as simple as that. Now, people, a lot of patients might ask if I am supposed to have protein, can I have non-veg as well? I say, see, the problem is not with the non-veg food. Problem is not with the chicken. Problem is not with the fish. The problem is the way we prepare, the way we Indians prepare it. So whenever we are preparing non-veg, we use excessive spices, we use excessive salt, we do deep frying or shallow frying, high temperature cooking. So that actually, kills the benefit of all this non-veg. They kills. So the harm becomes more than the benefit. So the problem is if you can have non-vegetarian, you can have, it's a good thing, but you're supposed to have it maybe in the form of a curry or maybe in the form of steaks, just like the Eastern Asian have, just like the Chinese people have, the Japanese people have. They don't use a lot of high temperature cooking, and that is why the risk of heart disease in them is less. But when we see in India, the type of cooking we do is slightly something which needs to be changed. Sugary food intake definitely have to decrease. So just like I told you, we have to cut down on our sugars, like in the form of sweet drinks, in juices, in the form of cold drinks. All these things had to be stopped. Coming to fat, actually, fat is something which I would like to discuss in detail. So when we talk about fat, for us, the source of fat directly is the usage of oil, the kind of oil we use, and the amount of oil we use. So I need to tell you this thing that stop